Welcome to the Derm Vet podcast, where pet skin is always in. I'm Dr. Ashley Bourgeois, board-certified veterinary dermatologist, skin nerd, and your go-to guide for everything itchy, smelly, and inflamed. I'm here to take the itch out of your day and make derm more fun than frustrating. Grab your microscope and let's focus in. Well, welcome to an episode of the Derm Vet podcast. First YouTube episode solo going up. In true busy vet mom fashion, I am recording this after a full day in the clinic and the kids have gone down because that's just the time I have, just like all of you. But for this episode of the podcast, I put up a question sticker about cytology. Cytology is obviously something I'm very passionate about as a dermatologist. You know, I like to say cytology everything. So I wanted to know the top questions you all had about cytology, whether it was collection, interpretation. And I have 8 common questions that were asked in some form or fashion within that question sticker. So I'm hoping to shed some light. Also, with doing a video, I get to put up some pictures and videos of cytology collection, which hopefully will be helpful as well. So let's start off. I got asked a lot about different collection techniques, specifically for skin. I think most people are pretty comfortable swabbing ears. But the number one question was, what advice do you have collecting tape prep versus collecting direct impression smear? So direct impression smear is my favorite. That's what I tend to do the majority of my time collecting cytology, but I have been taping a bit more, and I'll go over the situations that I utilize that. For direct impression smear, I think there's a couple different really important points to really make point of. One is I think that the biggest mistake I see is people not getting underneath crusts or using the edge of their slide to really kind of disrupt the epidermis and get a good sample. If I collect a sample and then you collect a sample, and remember, derm's all I do, and I get I'm more forceful, I get under crust, I could have like 4+ cocci and you might have, 1+ cocci. And we're going to get back into that later on this episode, why that makes it very difficult for us to give you really straightforward answers of how to treat what you see quantity-wise under the microscope. But you really want to take the edge of that slide and use it as a tool. I kind of use it I smear things pretty aggressively. So I know I'm going to break open neutrophils, and that's okay. But take the edge of the slide at that 45-degree angle and really get under that crust. And then you can kind of pat it once you get under that crust, under that scale, disrupt that epidermis, really squeeze the skin, because that's really helpful to make sure that you get a good quality sample if you're doing direct impression smear. The other thing I think is really important is using your non-dominant hand for leverage. So you want to take that skin and kind of push it up or pinch it up so you can really get a good sample. You can kind of use that plateau of tissue to make sure you get, a good pressure when you're collecting it. So when I see people take a slide and just kind of take their dominant hand and just pat it or rub it along, I don't think you're really getting a good quality sample. And you'll be able to tell by how much, squames, which are skin cells, neutrophils, if it's an inflammatory process, that you get on your actual slide itself. For tape prep, when do I tend to use that? So again, there's people who only tape, they love it, and that's wonderful. I'd say predominantly where I use tape are paws. I feel really comfortable getting direct impression smears from interdigital spaces, but I do get a lot of dogs that, they're uncomfortable. They're kind of donkey kicking me. They're tap dancing their feet around. It's very common for us to hear that dogs are, hate their paws being touched if they have a chronic history of allergies. So if they are kind of tap dancing around or they're starting to kick around, it's really hard for me to position that slide. Tape can be awesome in those situations to just be able to, kind of flex it into that interdigital space a little bit easier. And so if it's dry, if they're really struggling to let me kind of sample the paws, I find tape prep super helpful. I would say the other two areas I use it a lot in would be perioral. Again, I can get a pretty good direct impression smear from around the mouth if I need to collect that. But if they're dry, if they're scaly, if they're moving around a lot, it can be hard to like get my hand in there and get a good direct impression smear. So tape can be great. The other big one would be periocular. So when you get those dogs who come in or cats and they've got dry, erythematous, scaly skin periocularly, if they're like canified periocularly, I don't feel like causing a corneal ulcer with my slide. So tape is a really safe option to try to collect. The big reason I don't lean on tape as my primary method of collection is you just get a lot of stuff. So you have to read through different fields. You have to take your fine focus and go up and down quite a bit because it's sticky. So you're collecting a lot of different skin cells and debris and stuff like that. And that can really cause issues when you're starting to look at that slide underneath the microscope. So you have to use your fine focus to go up and down quite a bit to evaluate that. So it's doable, especially when we talk about looking for things like Malassezia, but I've certainly had really good cocci infection underneath the microscope too with tape. But those are just the things that you can have a bit of issue with. Really, someone was asking about what's my suggestion on tape. I don't have anything super magical for you. It depends on how still the animal is and, how well I can tape it. You want to get clear tape, not frosted tape. You don't want double-sided tape because you don't want your fingerprints getting all over the sticky side of the tape. But really it depends on how still they are. I do press pretty firmly. So just like I take pretty assertive cytology collections, I press my tape pretty firmly. So I'm going into the paw and I'm really pressing. I'm coming back, I'm really pressing. There's not a magical number of times to press it. It depends on how still they are, how inflamed that skin is. Is it a long-haired dog or a short-haired dog? If they have long hair, you can get lots of hair kind of tangled in it. But that's how I ultimately collect it. And I think either of those can be really successful depending on the type of lesion, the anatomical location, and what you feel comfortable with. You just have to know the limitations of each of these things. Question number 2, going along staining and tape prepping. So bouncing off tape prep, I got asked about how to stain tape prep. And there's two main ways that I am aware of that people utilize. So one, you do not need that light blue stain, that number 1 stain, right? Diff Quick has 3 stains. That number 1 stain is a fixative. Your tape is the fixative. It's sticky, it's grabbing onto it. You don't need to fix the tape. So you can take the tape, you can start in that pink eosinophilic stain, dip the tape, 5-8 times, whatever feels good to you. It's pretty fast. Dry it off, pat it down, get the excess stain off of there, and then go to the purple stain, same thing, rinse it off, and then put it on a slide, and then you can just put your oil immersion oil right on the tape on a slide. The other way that some people do it is they'll take the tape, they'll put it right on the slide, they'll take a corner of tape up, they'll put a drop of purple tape and press it down, and that's another way you can evaluate it. Personally, I like staining the tape in the pink and the purple. I just feel like it stains a little bit better, but either of those ways can be successful. But you do not need the fixative, the light blue stain. You can just go on to the red and the purple or do the drop of purple underneath the stain itself. But you will want to put oil immersion oil on top of the tape when it's on the slide so that you can get to that oil immersion field and look for things like Malassezia, cocci, and neutrophils. Question number 3, love this one. How can we get better at sampling interdigital spaces, our claw folds, in our allergic dogs? So I went over a little about interdigital spaces already, but again, the big thing is if you are going to get direct impression smears, you need to take your non-dominant hand and bring up that interdigital space to give you an area of leverage to sample. So I take that area, I flip it up from the palmar aspect of the paw if I'm getting the dorsal aspect, and then I sample my direct impression smear. Flip side, if I'm trying to sample the underside of the paw, their little paws kind of bent over, I'm going to take my finger, my non-dominant hand, I'm going to flip from the dorsal side, and I'm going to give myself pressure so I can sample with that slide. So you can do interdigital spaces. this. Certainly when we have things like furuncles or draining lesions, it's pretty simple to do. You can tape prep. So like we talked about before, if it's really dry, scaly lesion, they're moving around a lot, they're more aggressive, and it's hard to get a slide there, then you can take your tape like we talked about and sample your interdigital spaces. Either way, I am just thrilled you're thinking about it, because one of the biggest things I see as far as pets failing an allergy medication that once worked is that an infection has popped up and we have not identified it. So the fact you're even thinking about it, I am thrilled about. Now, claw folds. If you've watched the Derm Vet for a while, you know I love a claw fold cytology with a toothpick. So with those pets that are licking, chewing, kind of really corncobbing their little digits or their nail beds, get a toothpick, scrape along that nail fold, that claw fold, and then roll it onto a slide. Do that a few different times. You can do different claw folds if there are numerous ones affected, and then evaluate and stain it just like you would a direct impression smear, fixative, pink stain, purple stain, and then read that underneath the microscope. And man, you're amazed. Once you start doing claw fold cytologies on these dogs that, have been told Apical doesn't work, Cytopoint doesn't work, Zenrelia doesn't work, whatever it is, it's pretty amazing if you find infection and treat it, how well they can do, whether it's bacterial or Malassezia. So definitely get your toothpicks out and sample those claw folds, and it's going to help a lot of pets. Number 4, what advice do you have for sampling a dry lesion versus a wet lesion? That's a very good question. So let's start with dry lesions. So first of all, of course, you could tape them, right? So you could tape it so you have the stickiness that you can really get from that skin if it's really dry and scaly. I still have some pretty good luck doing direct impression smear on dry lesions, like truncal lesions. Again, I'm just very assertive. I use a lot of leverage with my hands. I'm really putting a decent amount of pressure on when I'm sampling them. So I find that helps me. Another thing you could do, depending on the lesion, is you could take a little sterile saline. If you have a swab, like if you're trying to get a facial fold and it's really dry, you could take a little bit of sterile saline on your swab to moisten the lesion, and then you could try to roll that onto a slide. I don't do that often, but I have done it. I would say my couple pieces of advice for that. One, get a lot, because that saline kind of dilutes things out a bit. Also, make sure that slide has some time to dry. I'm not a huge heat fixer, really. I'll kind of control what goes on the slide, but I'll let air dry for a minute or two, as I'm getting other areas on the body. But for dry lesions, depending on where it's at, like if it is a really scaly, nasal facial fold on a brachiocephalic and you're struggling to get a good sample, you could use a little saline to try to moisten that and then collect your sample and roll it onto a slide. The thing to really recognize about that is it's going to look a little bit more dilute. So because you're kind of using that saline and moistening it, sometimes I do find that the infections kind of spread out throughout the slide. So I really take some time to kind of read different fields, especially if I'm doing it that way. Wet lesion. So if you have a really moist lesion, serosanguinous debris, be careful how much you get on the slide. So if you have something like a draining tract, you don't need to just get a whole glob of pus and throw it on a slide. You can just get a little bit on a swab, roll it on a slide. You can try, I wouldn't use tape. Tape's not going to work super great in wet, moist lesions. I do a lot of direct impression smears, but that would probably be the opposite advice I've given you. And that's why cytology can be tricky, because it's really situational, is to actually not like squeeze a bunch and slap a bunch of pressure on it. If you have something that's really draining, like a deep pyoderma or a furuncle, you don't need to just squirt a bunch of stuff out and put all of it on a slide. You can probably use some pretty light pressure and get a pretty good sample. You want to make sure you do give it time to dry. You do want to make sure it gets fixed really well. Those tend to have a lot of neutrophils, sometimes macrophages, a lot of inflammation that's there, along with potentially infection. So those would probably be my advices between those two situations. Question number 5. Here's the one you guys are going to hate me for because I can't give you a great answer. How do you interpret number of Malassezia or bacteria on skin or ear cytology? And I'm going to give you that super annoying derm answer. It depends. It depends because you have to take into consideration so many different things. You have to take into consideration whether you're going to treat them topically or systemically. You want to consider, how symptomatic are they? What can the owner do at home? Like, is it possible for them to do topical therapy? Just had a conversation today with an owner. I got a really bad MRSP resistant, culture back. And so it's a small dog and they're able to do topical therapy. So before we go to like scary antibiotics, they're totally willing to do, every other day chlorhexidine baths, with every other day dilute bleach rinses. And that's where we're going to start. But not everybody can do that. And on cytology, I wasn't finding a ton of bacteria, but I've also been managing the dog for a couple of months. I know how difficult the pyoderma has been to get under control. I know how paritic this dog comes in, like tearing itself apart, despite all my best efforts with medications for allergies. So I know that cocci, though it's probably like a 1+2+, is causing a tremendous amount of issues. But I know they're able to do topical therapy. For my owners who can't because the pet won't tolerate it, they have limitations physically or just, emotionally bandwidth wise, then we might need to reach for something systemic, even when it's not as ideal. So we really have to consider that individual patient. Same with ears, right? I have some dogs with ears. If they have even a small amount of yeast, like a 1+ yeast, I mean, they are tearing their ears apart because they have something like a Malassezia hypersensitivity. I have some dogs where they have a pretty decent amount in their ears and owners come in saying they're doing great. So I may not jump to something like a really aggressive topical protocol. If they're symptomatically doing great, maybe we just try flushing, removing some of that debris. So those are all things that we have to take into consideration. Again, how symptomatic is the pet, how uncomfortable they are, how much infection's there, what's their history, which I know can be very frustrating and daunting. But it really does matter because we can have pets who are super crazy itchy despite little infection and others where we have a little bit more leeway. And, again, what can the owner can do? Is topical possible? What other medications are they on? All these are things that we have to consider too, even as dermatologists as well. So it is tough and I get it. We all want that beautiful little diagram that says, you find this much yeast, this is what you do. But just like all other aspects of medicine, that's unfortunately not how derm works. Question number 6. How do you differentiate between a deep pyoderma versus a superficial pyoderma? And this is something cytology is not going to necessarily tell you. With a deep pyoderma, you might see more macrophages, fibroblasts, things like that. But you could just see a bunch of neutrophils and cocci or rods on either a superficial or a deep pyoderma. So really that is more of a clinical diagnosis that I'm making by palpating the tissue and seeing what that pet actually looks like. So superficial pyoderma is going to be, more superficial. So it's mostly just affecting kind of that top layer of the skin. You're going to see erythema, potentially scaling, crusting, but you're not going to palpate deeper inflammation. So superficial pyoderma is the more common things that we see. A deep pyoderma is more when you grab onto that tissue and it feels, fibrotic, maybe scarred. If you have draining lesions, so if you have a draining tract, interdigital furuncles, like anything that's kind of erupting like a furunculosis, that's going to be a sign of a more deep pyoderma because you are getting more of that inflammatory process. It's going deeper into things like, the hair follicle, and you're actually getting ruptured skin that can happen from that. Really, the biggest thing is it might differentiate what you're going to treat it with. If you have something like a really, diffuse deep pyoderma, that could be really difficult to control topically. Whereas a superficial pyoderma, even if it's really widespread and looks bad, if they're committed, you might be really good at being able to treat that completely topically. You might have to do both of those things with a deep pyoderma, systemic and topical, depending on, again, so many factors of what you're treating. And then, don't forget the other things that we've talked about in the past with managing those. So if I have a really focal deep pyoderma, traditionally we have said those need to be treated for, 6 to 8 weeks. So we try to culture them. And I think culturing is still a good idea, especially depending on the pet's history, if you have a deep pyoderma or if they're immunosuppressed. But we have awesome tools like fovea, other things just to help see if we can kind of lessen duration, which I've talked about on previous episodes of the podcast of how long you're going to use those antibiotics. So we're always going to recheck them, but that would be the biggest thing I would differentiate is, is there, drainage? Are there tracks? Is it scarred? Is it fibrotic? Do you kind of touch it and you can just feel, you squeeze and like serosanguinous debris comes out versus just your typical like crusty superficial pyoderma. Question number 7, another annoying derm answer for this one. How many organisms do you consider 1 plus 2 plus 3 plus 4 plus? And annoying answer time, it depends. Because it really depends on your particular facility. And I think this is where it's tough. We tend to use more ranges at my clinic, but some of the doctors will use 1 plus 2 plus 3 plus. It's not an exact science. There are certain, companies out there who try to put together, this many, 0 to 10 cocci per per oil immersion field is 1 plus, whatever that looks like. But I think really you need to try to just get on some sort of common scale with the rest of the people you work with. Because even when we make ranges, like 5 to 15 cocci per field, it's still not an exact science. It depends on where my field lands. It's still kind of a, I'll count them, but it still really varies depending on what field I'm in. I'm more just taking an average feeling of it. But if you're doing 1 plus 2 plus 3 plus, you're kind of doing that too. So I would get together and just try to come to some sort of consensus. What is our general feeling for how many per field you're seeing? Because the biggest thing is if you end up rechecking someone else's case, right, which happens, then you may not really know what to judge if you're all using different fields. So if you think it went from a 2 plus to a 1 plus, but you guys have wildly different views of what that is, that might be really hard to tell. So I do think it's something that's best for you to, within the same clinic, come to some sort of consensus, but there's not an exact science on it. The other thing I'd really urge you to do is to make sure that you are also noting neutrophils, nuclear streaming, because to me, that really helps too if I see a lot of the inflammation resolving and the numbers going down. So again, it's not a standardized thing, cytology. There's so many different kind of opinions on it. So just trying to do your best sort of meeting of the doctors and technicians who read those cytologies and coming up with some sort of common ground would be really beneficial. And then last question that came in was, what are my thoughts of some of the new AI or digital cytology machines that are out there? So ones that I have had experience with that I've actually tried in my own clinic and gotten to try out is the Zoetis Imagist and then the Zomedica TrueView. And I know there's other ones out there too that I just haven't personally played with. I think there's a lot of potential there. I think just like anything with cytology, it very much depends on the clinic, your workflow, your availability with staff, your desire, how you do cytology. But I think the beauty of all these different machines coming out, and they all have different ways they work. TrueView stains the slide for you and puts a picture up so then you can look at it. The Zoetis Imagist can quantify things for you and also pull out things like bacteria and cocci. I don't think none, to my knowledge, read tape preps because that's really tough because of all the fields that tape ends up on. But they'll do things like aspirate, direct impression smears. I think one of the really big benefits of those, if you decide to use those, depending on your clinic situation, is most of them can also send images to a clinical pathologist that can get you a report very quickly. So versus sending it out and potentially waiting a few days and it could get lost in the mail, if you take a cytology you're not sure, you can usually, through most of these labs, get a clinical pathology report within a couple hours. So that's really beneficial and nice. So I do think there's a place for them. We still read a lot of our standard skin cytologies because, we might pick up on weird cells like acantholytic keratinocytes, neoplastic cells, which depending on what you're going to look at or try to quantify, some of those machines might not pick up yet. But I still think there is a ton of value in them. Again, very much depending on your clinic's workflow, what type of availability of staff you have, what your timing of appointments look like. But I'm glad all these different tools are coming out because every clinic is built different. Every clinic has different availability, different passions. And so I think it's great that we have different options and you can try those on and see what you really jive with and what you like. So I thought these were great questions you guys put forward. I always, again, love reading them. I'm just always curious to see, oh my gosh, have I talked about this too much? Are people sick of this? Versus, oh, that question's still popping up. I know you guys are really busy, so you're not going to see every little content I put up there. But hopefully just seeing some of these common things that were asked gives you a bit more confidence. Anything with cytology, I always say, practice, practice, practice. It is a very easy, quick learning curve with cytology, but make sure you're practicing. If you have a derm advocate or derm passion person within your clinic, a derm nerd, then, get their kind of tips in clinic, have them read your slides after you. Practice on patients when they're sedated or you're anesthetizing them for spays, neuters, dentals. Just practice the feel of getting good cytology from the ears, from the skin. That's going to be super helpful when you're collecting them in front of the client. So I really hope you find that beneficial and helpful. And remember, always to cytology everything.